Hi, I'll be going over the genital urinary inspection GU of male, and then I'll go over the female. The male, the first thing you want to do is introduce yourself and say what you're about to do, the exam you're supposed to do. Explain that it's not going to be uncomfortable. Wear gloves, wash your hands with your gloves. Clinician is supposed to be seated in a seated position, and the patient male is supposed to be standing. You inspect the penis, the shaft, to look for deviation, to look for warts, look at the skin color distribution, look for any lesions. If he's uncircumcised, then palpate the shaft. If he's uncircumcised, ask him to pull up the foreskin, inspect the glands, palpate the urethral meatus, see whether there's any exudate or any drainage that comes out, and the color and smell. Uh, Follow, check, inspect the testes, palpate, feel for nodularities, inspect the spermatic cord, that one as well for each testis, and follow it up to the spermatic, follow it up to the inguinal, external inguinal ring, and ask the patient to cough and feel for hernias in that case. For checking the prostate, ask the patient to bend over the examination table, wear gloves, explain to the patient that he may have a feel and sensation like he wants to defecate. Ask him to bear down, insert the lubricated finger through the rectal and feel the anterior side to feel for any the prostate, which should feel rubbery, almost like a pencil eraser, about less than a centimeter. Feel for the lobes and feel for the consistency of it, see whether it moves, ask whether it hurts, and that's the end of that. For the female, you want to do the same thing, explain and wash your hands and follow procedure, the policy for your place of work. But with this, for the female, you want to alert the patient and place the patient in a lithotomy position and drape the patient appropriately, allowing for communication between you and the patient. So the first thing you want to do is assess the mons pubis, hair distribution, urethra, labia majora, labia minora, clitoris, anus, and perineal area to look for lesions, warts, any drainage or discoloration of the skin, assess for skin for maturity. Then you want to get a lubricated speculum that is warmed up with water, and then insert it at a 45-degree angle while applying downward pressure at the base of the vagina, and go ahead and rotate it back and insert it as far up as you can in the vagina as far as you can, and open the blades, see the cervix and the os, and lock it. Note the color of the vaginal wall, look for lesions, look for erythema, drainage. Once you're satisfied, go ahead and unlock it, close the blades, and retract it using the same fashion. Apply downward pressure as it comes out through the introitus. To look for to inspect the vaginal walls, you want to palpate for any nodularities around and any discoloration. For the cervix, you want to place 2 fingers and check for consistency. You want to look for nodularities. For the uterus, you want to do a bimanual where you place one hand outside and 2 fingers, one index and one middle finger, and palpate the walls of the uterus and see the position of it, see whether there is any discomfort. For the cervix, I forgot to mention this, you're supposed to shake and check for any tenderness with cervical motion tenderness called, and ask the patient whether it hurts. For the checking the ovaries, you do the same thing. You insert it in the cervix, and you sweep a downward motion on each side of the ovary that you're assessing. So let the patient know that this is a little uncomfortable and this is normal. but you need to look for the size of it and see whether it's enlarged, whether it's got um, any difference in symmetry of the two ovaries. Thank you. That brings the end of the exam. Thank you.